Good evening and welcome to this special edition of Newswatch on this Sunday evening. It's an important and historic weekend for Gibraltar. Unfortunately, it's also one which comes with sad news. Today, Gibraltar mourns the death of 4 Gibraltarians, 4 additional deaths. That outbreak at elderly residential services still very much alive. The sad news coincides with the arrival of the vaccine in Gibraltar yesterday evening. On Saturday at 5 minutes to 6, a military plane carrying almost 6,000 Pfizer vaccines landed at Gibraltar Airport. With it, a ray of hope. A dark day, gloomy skies, but a ray of hope. A military aircraft carrying 5,850 Pfizer vaccines has just landed in Gibraltar at 5 minutes to 6 this Saturday evening. Tomorrow, the vaccination program begins in Gibraltar. And as you can see behind me, the vaccine has been offloaded from the military aircraft. Moments before it landed, we saw the arrival of Fabian Picardo and the governor. The vaccine will now be transported to St. Bernard's Hospital, where it will be stored in specialized freezers.
Like every Gibraltarian, I'm sure I'm very pleased to see at last the arrival of the vaccine. I don't think Gibraltar has been as expectant for the landing of a Royal Air Force aircraft before as much as we have been today. Looking, we hope, at the beginning of the end of the nightmare that COVID has been. We're not there yet. This is only the beginning of the end. But at 5 o'clock tomorrow morning, we start to inoculate our frontline staff. We then start to inoculate the residents of ERS, and on Monday we start to inoculate the elderly members of the community. A real positive day, a historic day, but this time a historic day that we can all be proud of and look forward to.
And all systems go. The vaccination program rolls out tomorrow. You start vaccinating those frontline workers, the elderly, those priority groups. 5,850 vaccines, doses, I believe, have arrived in this first flight. How long will it be before they're all used up?
So we expect that we'll be seeing about 580 vaccinations a day. So you just multiply by 10 and you would get there. I mean, they'll be happening in the frontline staff inoculations in the hospital. It'll be happening in ERS. It'll be happening in the community as well. So all of that together will get us to be able to use all of those doses very quickly. But the one thing I want to emphasize about today is that you've seen a string of people working together to create the strong cord that is the British family of nations. So from the British government sourcing the vaccines, the FCDO ensuring it was available for the overseas territories, then the MOD making sure that they could deliver it, because this vaccine could not come on the type of aircraft that land in Gibraltar or in a private jet. Now the GHA prepared and organized to start the process of inoculation. So if you think about it, as each of those jabs goes into a Gibraltarian arm, the process started thousands of miles away. The work started months ago as the scientists tried to find the vaccination, and each of us in Gibraltar who wants the jab will be lucky enough to be able to have it because of all that work coming together.
I think it's been down to a lot of people. The MOD, of course, transported it, but if I may, I'm going to praise the Foreign and Commonwealth Office as well. They have managed to do all the dealings to make sure that the vaccine is supplied to Gibraltar. and also the government of Gibraltar for all their efforts in helping us to put the case for the amount of vaccine we need in Gibraltar. So this hasn't just been one effort, this has been a joint effort across the 1,000 miles, and the result of it is clear to see tonight.
We've seen the first batch arrive today. What can you tell us about that supply? People were wondering about whether that supply will be continuous, whether it will continue. What can you tell us about that?
Well, we're hoping that it's another supply, a much larger supply in 2 weeks' time, and then another week after that we hope we'll get some more. So I'm rather hoping that with this supply we'll inoculate a third of the population of Gibraltar, and then we'll be able to do as much as we can over the next few weeks. I think this is really exciting. By the end of the spring, we should have vaccinated nearly everybody in Gibraltar, those that want to take the vaccine. I think this really is the end of COVID in Gibraltar by the spring.
Well, our first priority is to cover the maximum number of people with some degree of protection. The research that's now been carried out by the Joint Committee on Vaccination and Immunisation suggests that the protection comes in 2 weeks after your first dose, and you get about 90% protection. The advice is that you get your second injection at least 12 weeks before the time is expired. Now, we expect to get our second batch of vaccines about 3 weeks after. So actually, I think our plan is to make sure that everyone does get their second dose that got it the first time.
Obviously, research very alive as well. That initial fear, people with allergic reactions, even that has changed, hasn't it, in the last few days?
It's a very rapidly changing arena. So now we're saying that breastfeeding mothers can have the injection. Allergy is now so assumed to be so severe that you have had to get anaphylactic reaction against multiple different drugs, or an unknown anaphylaxis. Anaphylaxis is a really severe allergic reaction that can stop your breathing, it can puff you up, and most of those people would have EpiPens, I would hope. Nearly all of them would have some kind of adrenaline, injectable adrenaline. And what that means is that you would know if you had had an anaphylactic reaction. Now, lots of people are asking me, I'm allergic to penicillin, or I'm allergic to this drug or that drug, or eggs. That's not a contraindication at the moment. Certainly would like to know whether you have, but don't think that the vaccine is not appropriate for you. It is. The only question mark we're left, as you would with any drug, is it safe to give in pregnancy? And the advice we're giving is consult with your consultant obstetrician. They have the best and most recent research. I can't see a biological reason why it would be wrong to give pregnant women. I think hundreds of thousands of women have had coronavirus infection whilst they were pregnant, and it has only produced some minor effects in the majority. A few have been, unfortunately, a little bit more serious than that. So your consultant obstetrician is the best person to give you the advice. But apart from that, really the contraindications, that's the word we use, which is to say you shouldn't have it, are minimal.
The batch for tomorrow will be taken out of the freezer at 5 o'clock in the morning so that they start defrosting, ready for the first vaccines to be delivered in the morning. We're going to be vaccinating in 2 locations tomorrow, so there'll be 2 exercises happening in parallel. The first one will be at St Bernard's Hospital. It will be at the primary care here at St Bernard's Hospital, and that will start the vaccination programme for all frontline workers in the GHA and in the care agency. And in parallel, we'll also start the vaccination programme for ERS residents and all frontline staff at ERS.
You mentioned ERS there, quite a spike. The community concerned, what can you tell us about that?
Well, the first thing I want to say is that I want to thank all the staff at ERS for the absolutely tremendous work that they have done throughout the whole year, but particularly during this difficult time because of all the positive cases that they have with the residents on ERS. And there are also a lot of staff members who are positive or in isolation because of those who are positive, and that makes their job that much more difficult. I can assure you that the management at ERS have done absolutely everything possible to keep the virus out. But unfortunately, the virus has been so prevalent in our community that it has found itself into ERS as well. But I know that everyone at ERS are working their hardest and trying their best to keep all the residents safe, and they will of course continue to do so. That's why the vaccination programme is so important. It's all the more important for everyone who is vulnerable, and that's why I call on the public to take up the invitation for the vaccination programme. The programme is very complicated in the way that we're delivering it as well, because of the delicate nature of the vaccine. We have to be very regimented in the way that it's delivered. So I ask that everybody who's been offered an appointment already to attend their appointment on time, to be there promptly, and for everyone to attend, because if people don't attend and everything's been organised for them, it may risk the loss of a vaccine, and that would be a tremendous shame given all the efforts that we've gone to procure them. And I'd also like to inform the public that we have not called everybody yet. The people who will be contacted for this first batch of vaccines will be people who are over the age of 70 and people who are severely clinically at risk. So those are our priority groups. But we are still calling people, and we haven't called everybody yet. So I just want to assure the public not to be worried if they still haven't received that phone call, because if they are in that group of people, that can rest assured that they will receive a call.
17:55 hours, the time of arrival of the vaccine in Gibraltar on board the military aircraft, which came from RAF Brize Norton. At around 1900 hours, it was delivered with military precision by the MOD, escorted by the Royal Gibraltar Police. The vaccine is now safely in the hospital. It was unboxed and iced and stored in those special freezers. It will remain there till tomorrow, Sunday, when at around 8 in the morning, Dr. Chris Ruel will be the first person to be vaccinated in Gibraltar. The GHA staff, frontline staff, priority workers, will be vaccinated throughout Sunday. And on Monday, the first members of the general public, that first priority group, will be vaccinated. And with the vaccine now in Gibraltar, time is of the essence. The GHA is working round the clock to get as many of its frontline health workers vaccinated as soon as possible. At 5 this morning, the vaccine was brought out from that special freezer. Doses were delivered to ERS to administer to its elderly residents. Meanwhile, here at St Bernard's Hospital, GHA frontline staff were queuing up this morning to receive their dose. The GHA is protecting its frontline workers so that they can continue working to protect the community. GBC understands 280 frontline staff workers are being vaccinated during the course of Sunday. Among them, the GHA's medical director, Dr. Chris Ruel.
I feel great, very, very proud to be the first, very pleased to have it done. But perhaps I think more proud to have seen the team in action this morning. This vaccine is a very interesting vaccine, lots of little interesting facts about it which have made it different to any other vaccination program that we've ever done. And I know that everybody's aware that the eagerly anticipated arrival of the flight yesterday, even that had difficulties in terms of the flight that the aeroplane that we chose because of the vibration of the aircraft. The vaccination and the vaccine itself and the contents of the vaccine very, very, very delicate. So we had to be very, very careful with that. Of course, there are images that you saw last night of us storing the vaccine in a minus 80-degree freezer to keep that vaccine safe. And then the teams have been up this morning at 5 o'clock in the morning to remove the vaccines from the freezer to allow a 3-hour thaw period. So as soon as they were removed, still in their frozen state, they were taken to the different locations, up to the elderly residential services. They were taken to the old primary care centre in the ICC, which is where we're vaccinating people from the community, and then they were obviously brought here as well, so we're vaccinating frontline staff. So in itself, even those logistics are quite interesting and add that extra nuance to the programme itself. And then for the teams this morning, each of those little vials, once they're thawed, we actually add a little bit of liquid. It's sodium chloride, salt water basically, but sterile salt water. And you can get up to 6 doses out of that. And each of the vaccinators will prepare 6 doses out of that. So you can be very, very careful with how you take it out. The recommendation from the manufacturer was they made it with 5, but with the correct careful handling, we can get 6, which of course increases the number of vaccines we can give to everybody. So then they prepare 6 vaccination syringes ready to go, and then we bring people in one at a time to the vaccination stations. The volume of each one is only 0.3 mils, and a normal vaccine that we've all had as children, or the tetanus vaccine, is usually at least half a mil, maybe more. So this is 0.3 mils, completely and utterly painless. I didn't even notice it because it's such a tiny amount. So it's a very interesting vaccine, this one, and I'm delighted to be the first. I'm very proud.
And throughout today's Sunday, elderly residential services staff and residents will be vaccinated.
Yeah.
Now, we do know there's an important outbreak at ERS facilities. But a question there, will people who currently have COVID at ERS be vaccinated, or do we have to wait for them to recover first?
Yes, unfortunately, as you know, with all of these things throughout the whole of the pandemic, everything's been very dynamic in terms of that information. And we've waited to receive a lot of the guidance from the manufacturer. Some of those guidance and contraindications having the vaccine have changed even in the last 24, 48 hours. But the two that really stuck are that if you have symptoms of COVID, or if you are COVID positive, you cannot have the vaccine until, if you're COVID positive, till 28 days after your swab, or until you're asymptomatic. So, of course, there are a number of people up at elderly residential, and there'll be other people in the community, of course, and members of staff who at this point cannot have it. But, of course, they will be in isolation, so we will be protecting them anyway. And then we will make sure that we keep their names ready for towards the end of this particular phase of the vaccination campaign, or when we receive the next set of vaccinations, if their COVID positive period takes them longer than this phase.
So for those who will be attending the primary care centre tomorrow, who've been asked to attend,
Yes.
they've been identified as a priority group who need to
Correct.
be vaccinated soonest.
Yes.
What's the best advice? What would you ask of them? And who should they notify should they not be feeling well tomorrow?
Okay, so the first thing to say is, and most important, as you can tell, we've received a relatively small amount of the vaccines. It's very important we get all of the most vulnerable and the frontline staff done as quickly as we can. The sooner we do it, the better. So if you've received a phone call and invited you for an appointment for a vaccine, please, please, please move heaven and earth and try and come and have that vaccine tomorrow at the date and the time that we've allocated for you. If you are not feeling well, then please call the 111 line and go through the normal procedure, but also advise them that you've been offered a vaccination appointment, and they will give you the advice as to whether you should or shouldn't come, and then they will give you the advice as to who to contact to potentially cancel that or postpone that appointment if you have to.
And how many people will be vaccinated in Gibraltar with this first batch? And what proportion perhaps of GHA staff and the care workers and general public?
So the numbers, of course, will change on a daily basis, but let me give you just some examples. Today, here in the GHA, we're going to vaccinate 288 people as our first day. Today, we're working from 8 till 6. So just throughout the day to vaccinate, and thereafter about 250 people a day. The batch that we received on the aircraft yesterday came with 5,850, but that was based on 5 doses. But if we can get 6 doses, it takes us up to just over 7,000. So if we can deliver, which we will, to every single one of those doses, over 7,000 people in this phase. And that should take us very nicely through to the next phase in a couple of weeks' time when we receive some more.
And what can you tell us about that first priority group, that first group of members of the community who will be vaccinated? What are we looking at?
We're looking at members of the community who are over 70, because of course that's the one thing that we've learned very much throughout the pandemic. It really is a virus that more severely affects those in the older age groups, and those with significant medical conditions that mean that their immune systems are reduced, and therefore they're much more at risk. And we have gone through all of those lists. We've identified the list of people who are registered within our health system. We've looked at them, we've looked at their ages, and then we're calling to offer the oldest members of our community. Clearly, we've almost gone in age priority as well, the older, and then bring it down from there, and also those with the medical conditions.
And as the vaccination is rolled out in Gibraltar, another important aspect, no doubt, and one which worries people a bit, is the fact it's a new vaccine what follow-up will the GHA have with people who've had the vaccine administered? Is there a hotline for people to call should they not be feeling well? What sort of follow-up will the GHA have?
So, of course, every single person who has the vaccine, it's recorded in a number of different sources, including, of course, your medical record, which is the most important place where everything that happens to you medically is recorded. And that will include details such as when you had it, what the batch number was, how much you had, who vaccinated you, all of those very, very specific details. And, of course, even to the point where if you are starting to feel unwell, you can report that through the normal channels, speak to your own doctor, speak to your GP about that. But there will also be an information line, the details of which we are yet to publish, but where we can report any adverse incidents and issues which may be related to the vaccine. But I would caution how I say that, because of course there are lots of coughs and colds going around at the moment. There's lots of flu, and of course still, just because we have COVID doesn't mean all the other medical conditions have gone away. So of course, even if you've had your vaccine, you must report your symptoms, and let's not necessarily assume it's the vaccine. Some people may have a small reaction to the vaccine like any other reaction, a sore arm or a bit of a fever for 24 or 48 hours, something like that. But we must also be vigilant that there are lots of other medical conditions going on, and we must all as clinicians, have an open mind to make sure that we make the right diagnosis for anybody feeling unwell, whether it's related to a medical condition or whether there is something related to the vaccine.
And once you're vaccinated, masks and social distancing still to be respected still continues, because you could still be a carrier, couldn't you?
Yeah, so this is very frustrating, of course, isn't it? Because that's half of the hope for people, is that you can have your vaccine, then take your mask off, and skip down the street and reduce your social distancing. The issue being that now with this vaccine in my system, my immune system now will develop an immunity to it. But that doesn't stop me being somebody who can touch it and potentially transfer it to somebody who hasn't had the vaccine. So for the moment, until we can build the numbers of people who are vaccinated in the community, we're going to just have every single precaution, every measure still going.
And for those who've been vaccinated, do they have to take any extra precaution? I mean, would the immune system be lowered whilst the vaccine reacts? Do they need to isolate for a period while it kicks into action?
No, there's nothing specific where that's concerned. Obviously, like any vaccine, and we've all had vaccines of one form or another, you get a bit of a sore arm, you may feel a little bit fluey. If it's just a little bit of a low grade, just not feeling well, then just treat it as normal, as you would any other vaccine issue, which is, maybe just stay at home and rest, and lots of fluids, maybe take a Panadol if you feel a little bit uncomfortable, something like that. From there's no specific instructions from there that you have to isolate for a period of time, because don't forget that this is not a live vaccine. So it's not a live virus that's in there. There's fragments of the vaccine that are in there. So it doesn't mean that you're excreting more vaccine and giving the vaccine to other people. What it means essentially is that you just have to look after yourself, be sensible. If you're not feeling well, stay at home and treat yourself as if you're not feeling well, but not just because you've had the vaccine.
And here at ERS, that worrying outbreak still very much alive. The government today confirms 4 further deaths. But among the worrying numbers, some comfort. The medical director, Dr. Chris Rual, tells GBC that most of the positive cases are asymptomatic, with most of the residents who've tested positive displaying no symptoms or showing no signs. And early this morning, vaccination of care workers and elderly residents got underway.
A moment many have waited for. This is the vaccination team at Elderly Residential Services this morning, ready to vaccinate residents at Hillsides, the most vulnerable citizens to COVID-19. ERS staff were also vaccinated. The first to be vaccinated this morning was Robert Durrell, a 93-year-old resident at Hillsides. Mr. Durrell was a nurse by profession, founder of the School of Health Studies, and responsible for training nurses locally from 1950 to his retirement in 1990. As a nursing tutor, he mentored a generation of nurses at the GHA, and the health authority said they wanted to recognise and thank Mr. Durrell for his dedication to the development of nursing in Gibraltar. Today, ERS residents at Hillsides were vaccinated with the first dose of the Pfizer vaccine. It is a particularly heartening scene when you consider the worrying rising numbers of positive cases at ERS over the past week.
So we have over 60 at the moment, so I mean, it just is a very, it's a real illustration of how difficult it is to control this virus, because ERS of all the locations are the tightest and best when it comes to controlling this. They're swabbing their staff on a daily basis. They've been incredibly good with their PPE, with all their restrictions and their hand washing and everything, and obviously stopping visitors. Even so, what I can say to you is that out of the 60, very few are actually showing any symptoms, interestingly enough. So I think we have a very small handful. I can't give you the exact numbers today. The last numbers I was given, I think, were yesterday, the day before, and I think it was 4 or 5 had symptoms, but over 60 have tested positive. So in itself, that is reassuring that we have such a large number of people who are asymptomatic, and very few who actually have symptoms, but clearly they're in a much older age group. Their immune systems are clearly not as strong because they're in the older age group. So that in itself is a worry for us. So we keep a very close eye on that, and we're obviously taking care of them very well.
This was their first dose, and they are no doubt already eager to receive their second in a few weeks. The GHA thanked Care Manager Susan Vallejo and Dr. Antonio Marin and all the management and staff at ERS for achieving what they called this important milestone today. A milestone indeed, after what has been a long 10 months.
It's been a very busy week, and there's still a lot of hard work ahead for many. The GHA are preparing for a very busy week. The vaccination program is being rolled out to the wider community from very early tomorrow morning from this very location, the site of the former primary care centre. Members of the general public who've been identified as high priority have been contacted by the GHA. They've been asked to attend tomorrow for the vaccination at allocated times. The site of the former primary care centre has been transformed during the weekend as part of a Team Gibraltar effort. The Macias family, landlords of the ICC building, have offered the site for free to the government. And GHA and public sector workers, they've been working round the clock this weekend to ensure the site of the former primary care centre is a fully functional vaccination centre from tomorrow Monday. The GHA expects to vaccinate up to 250 people every day. And that's where we conclude this special edition of Newswatch on this Sunday night. The vaccine is now in Gibraltar. Our frontline health workers are being vaccinated. And tomorrow, hope is ignited. That community vaccination program gets underway. Meanwhile, the GHA and many others will continue working around the clock to ensure as many of our vulnerable people are vaccinated as soon as possible. In the meantime, we must all do our bit. Stay home. Stay safe. From the news team, many thanks for watching. Good night.
We would never put our people at risk. We would never suggest that you have a vaccine if it were not good for you. So please follow the advice, follow the science. Science is going to shine the way out of this dark tunnel.
To get this vaccine in after so much effort by so many people, and now it will start the end of COVID in Gibraltar.